Welcome to A to Z Nursing Vlogs. This video is about the infection prevention and control. Microorganisms exist everywhere. Because it is not always possible to know which clients may have infectious organisms, a set of guidelines has been established by the CDC. All healthcare workers must follow to reduce the chances that organisms in blood, potentially infectious organisms from other part of the body tissues will be transmitted from the client to other individuals. The standard precautions. Standard precautions are used in the care of all hospitalized clients. These precautions are applied to blood, all body fluids, non-intact broken skin, mucous membrane. It is designed to reduce the risk of transmission of microorganisms. Perform hand hygiene after contact with all the body fluids. Wear clean gloves when touching the blood and other body fluids and contaminated items. Wear a mask, eye protection or face shield if splashes or sprays of blood, body fluids or secretions can be expected. Wear a clean, non-sterile, non-resistant gown. The gown is intended to protect clothing. Handle the client care equipment that is soiled with blood and other fluids to prevent the transfer of microorganisms to others and to the environment. Handle all soiled linen as little as possible. Place used needle and other sharps directly into the puncture-resistant containers as soon as their use is completed. The transmission-based precautions are used in addition to these standard precautions in the case of airborne, droplet, or the transmissions by the contact. Airborne precautions. It is used along with the standard precautions. Place the client in an airborne infection isolation room that has a negative pressure, 6 to 12 air changes per hour, either discharge of air to the outside or a filtration system for the room air. If the private room is not available, place the client with another client who is infected with the same microorganism. Wear an N95 respirator mask when entering the room of a client who is known to have or suspected of having a primary tuberculosis. Susceptible people should not enter into the room of a client who has rubella or varicella. Limit the movement of client outside the room to essential purposes. Place a surgical mask on the client during the transport. Here we have the droplet infection precautions. It is used along with the standard precautions. The client should be placed in a private room. If the private room is not available, place the client with another client who is infected with the same microorganism. Wear a mask if working within 1 meter of the client. Limit the movement of client outside the room to essential purposes. Place a surgical mask on the client during the transport. Here we have the contact precautions. It is again used with the standard precautions. Place the client in a private room. If a private room is not available, place the client with another client who is infected with the same infection. Wear the gloves as described in standard precautions. Wear a gown when entering a room if there is a possibility of contact with infected surfaces or items, or if the client is incontinent or has diarrhea, a colostomy, or wound drainage not contained by a dressing. Limit movement of client outside the room. Dedicate the use of non-critical client care equipment to a single client or to clients with the same infecting microorganisms. Hope this video was informative. Thanks for watching.